I'm Dr. Cecil Bennett, and I'm a practicing family physician. And like you, I have struggled over the years with the issue of medication adherence and polypharmacy. With all the technologies available to us today, why are we still using primitive means of subjectively evaluating our patients' medications?
All right, Mr. Newby, you can go ahead and examine you here. And you just take a deep breath, let it out.
I thought there had to be a better way. There had to be a better way that providers and insurers could capture and evaluate objective data on medication use by our patients on a daily basis. There had to be a better way to reach those patients most in need of aggressively keeping them on track with their medications to prevent hospital admissions, readmissions, heart attack, stroke, blindness, amputation, and other long-term issues due to medication non-adherence. I think I've created a tool that can finally and objectively measure medication adherence that is non-invasive and cost-effective. The tool is called the Bennett Polypharmacy Profile, or the BPP. The BPP utilizes the same LCMS technology used in UDS or urine drug screens with proven sensitivity and specificity of greater than 95%. Let's look at how the BPP can help you in your practice. The Bennett Polypharmacy Profile. The Bennett Polypharmacy Profile is a unique urinalysis of the most common drugs prescribed by physicians. And again, it's a simple urinalysis that covers the following classes: blood pressure, cholesterol, cardiac medications, over-the-counter pain medications, some herbal supplements, migraine medications, and psychiatric medications or mental health-related medications. This is an example of some of the medications available in the Bennett Polypharmacy Profile. Just to look at the headings: blood pressure, the most common drugs used in blood pressure control today; diabetes, common drugs used in diabetes. In your bottom right-hand section, the SSRIs and other antidepressants and drugs used in mental health are here as well. And above that, there's some psychiatric and related drugs that are available for evaluation on the BPP. Let's look at some results. Here are actual results of patients that have been screened using the Bennett Polypharmacy Profile. This patient was born in 1938. It's a female patient. The top section shows the patient has taken alprazolam, amlodipine, and several other drugs. Below that, you'll see a green section. In that green section, it tells you what medications the patient is taking that actually is in their system. In this case, the metformin is present, hydrochlorothiazide is present, lisinopril is present. If you look at the first red section, this tells you which medications were prescribed that were negative in the patient's system. In this case, the patient was not taking alprazolam. Now, this could be PRN, so that may not mean a whole lot for alprazolam. But what's alarming is that this patient is negative for glipizide for their blood sugar, they're negative for amlodipine for their blood pressure, and they're negative for their atenolol. This is a patient you would have to bring back into the office and find out exactly what's going on. Was the patient referred to a specialist and their medications were changed? Is the patient non-compliant? But clearly there is some intervention warranted in this patient. So when looking at the different mechanisms of action, the different medications you can use, when you're looking at, for instance, the effect of beta blockers, that would affect heart rate by decreasing heart rate and therefore decreasing blood pressure control. I've been an educator or in family medicine for 20 years this year. I enjoy collaborating with my peers on issues that improve the quality of life of my patients. When you're looking at something like diuretics, that's going to affect stroke volume, decreasing stroke volume, decreasing blood pressure. When you're looking at ACE inhibitors or looking at angiotensin receptor blockers, this is going to decrease total peripheral resistance and in turn decrease blood pressure. So you can see for the most common medications that are used for blood pressure control, whether it's beta blockers, diuretics, ACE inhibitors, or angiotensin receptor blockers, that the overall effect is to decrease blood pressure.
Or you're trying not to?
I believe the BPP is such a tool that can actually make a tremendous difference in reducing morbidity and mortality in our patients. Well, I've been asked, has the BPP been proven in studies to reduce morbidity and mortality in patients who are non-compliant? And my response is this. Just like the blood pressure cuff or a glucose meter, the BPP is just a tool that gives you an objective measurement. It is up to us, the provider, to use that tool to better serve our patients.